Should I take biotin for my hair loss? My hair's falling out since my surgery. What can I do to stop it? I'm asked both of these questions frequently in my Facebook group. Are you experiencing this too and have the same questions? What can you do about it? The right nutrition strategies are so important after your surgery. Coming up, I'll answer the biotin question, plus share specific foods to include in your diet for new hair growth.
You spoke and we listened. Our chewable multivitamins are now dye-free, meeting your demand for more options. These dye-free chewables join our calcium chews and multivitamin soft chews in the dye-free lineup. Visit ProCareNow.com and use code Susan10 to save money.
I'm bariatric dietitian Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast. Are you frustrated with all the confusion when it comes to nutrition? I get it. It's hard to decipher sound science from pseudoscience. Try intermittent fasting or obesity medications, or maybe just reset your pouch. It's really enough to make you give up and say, I don't know what to do. I don't know what to believe. Well, I do. I know what to do. It matters where you get your nutrition information. When it comes to your bariatric surgery, nutrition is specific. So let's cut through the nonsense. Let's get what you need to know now. I created the Bariatric Surgery Success podcast to give you accurate information you can count on. Simple, actionable, step-by-step strategies that work. I want you to feel great every day. Get out there, do all the things on that bucket list. You're in the right place, friend. So let's get started. So what are you having for dinner tonight? Do you need some quick ideas? I'm a big fan of sheet pan dinners, and I use them often. I use salmon, shrimp, chicken, and the reason I do them often is that they're fast and easy. I can put the protein source, cut up vegetables, put them all together on a pan and have them ready in no time. So I've put together some for you to try. I'll put the link so that you can find the link or the QR code for the freebie. It'll be in the show notes, or if you want to find them right now, you can go to breakingdownnutrition.com/sheetpandinners. That's breakingdownnutrition.com/sheetpandinners. I know you may be losing your hair. Deep breath. Breathe in, breathe out. I know it's frustrating, but here's some good news that you're going to like. After rapid weight loss, and this happens typically with bariatric surgery, hair loss is common, but don't miss this. It's not permanent. Did you hear that? It's not permanent, and your hair should grow back. So the big question I'm asked, should you take biotin for this hair loss? Maybe a friend has taken it and swears by it. Maybe you read online that if you take biotin, you'll have new hair growth in no time. Well, while biotin, which is a B vitamin, by the way, it's important for hair health, you should get enough from your bariatric multivitamin. In addition, small amounts of biotin are found in lots of different foods, especially eggs, nuts, salmon, sunflower seeds, and some vegetables, including sweet potatoes. So once you're back to eating a regular diet, you can include these foods that contain biotin. But even if your diet is not quite there yet, consuming too little biotin may not be a problem anyway. And this is because intestinal bacteria produce biotin. So don't miss what I'm about to say. Come in close. Too much biotin, and this amount has been suggested to be about 20 milligrams a day. So too much biotin interferes with the testing of thyroid function and causes false lab reports. So if you have Hashimoto's disease, for instance, or you're taking thyroid medications, you can get inaccurate results on thyroid function, which then could also affect medication dosage. So taking your bariatric multivitamin is typically never a problem as the amount is appropriate. And typically it's going to be about 0.6 milligrams a day in a bariatric multi versus that 20 milligrams a day, which is way too high. So additional supplementation is not a good idea. I know. You want hair growth right now. I hear you. So I get the interest in biotin. It feels terrifying, but it's totally normal to lose 5 to 15% or so of your hair from bariatric surgery and the rapid weight loss that follows. So it goes hand in hand. You have the surgery, you have the rapid weight loss, and then you see the hair loss. But typically, it doesn't last more than 6 months. I know it's a pain in the patootie to go through, and 6 months seems like forever. But hair goes through cycles. So let me explain. Hair loss happens for many reasons that include stress, thyroid issues, extreme diet changes, too little protein, too few calories, hormonal imbalance, and an iron or a zinc deficiency. Even medications like a beta blocker or too much vitamin A can result in hair loss. So think about your situation. You've had surgery or you're planning to, so I want you to know about this ahead of time. You've reduced your calories very low for right now, possibly too little protein, maybe an underactive thyroid. And then if you sprinkle in some low levels of iron, zinc, biotin, or folate, you have a recipe for hair loss. So you can see the many factors that affect it. So there are 4 phases in a hair follicle cycle, maybe more than you ever want to know. But I think this helps you to get a feel for why things don't happen just immediately the way that you want them to. The anagen or growth phase, the catagen or the transitional phase where the follicle detaches from its blood supplies, the telogen or the dormant phase where the hair follicle is relatively inactive, and the exogen phase where the hair sheds. Any guess which phase or phases bariatric hair loss is tied to? You got that right. Telogen or the dormant phase and exogen or the hair loss phase. It seems the hair follicles are pushed, maybe forced into this dormant phase with surgery, which typically lasts 3 to 6 months, and then the hair falls out. So are you within this window? And to be even more specific, hair loss is common with gastric bypass and gastric sleeve because you tend to experience a more rapid weight loss and an increased chance of vitamin and mineral deficiencies. The physiological stress of surgery and the rapid weight loss can cause the body to focus vitamins and minerals on the heart, the brain, and the other functions instead of hair growth. This is when you see the growth phase or the growth phase end and the telogen or dormant phase start. So that dormant or telogen phase kicks in, and then it gets followed by the exogen phase, causing the hair loss to occur. But as your body adjusts to the weight loss, the hair loss slows and then it stops. The caveat here, and which is the good news, is that your hair should grow back normally if there are no vitamin and mineral deficiencies. So the reason why bariatric multivitamins every day are so important, and you're consuming adequate protein, that's 60 to 80 plus grams every single day. That's why you always hear me focus on protein, protein, protein. So here are 3 nutrition strategies you can put into action right now. Number 1, follow up with your healthcare team for blood work to make sure you have no underlying health issues such as a hypothyroid that would affect hair growth and loss. And at the same time, lab work can check for vitamin and mineral deficiencies such as iron or zinc. And usually your healthcare team has a certain period of time when they want you to come back. If you're feeling abnormal and you're thinking to yourself, something just not right here, then you may need to go back early and follow up and make sure everything's A-okay. Number 2, take your bariatric specific vitamin and mineral supplement daily or as your product recommends. Now you'll notice I said bariatric specific, and that's because this is a situation where bariatric specific supplements matter. They're designed to work with the losses we know from science that occur with bariatric surgery. So they should contain iron and zinc and biotin and copper and other nutrients that are needed for healthy hair. Don't miss this. If you do not have a deficiency, taking more of these supplements will not make your hair grow back any faster. And excessive levels, such as an excessive level of vitamin A, for example, or zinc, can be harmful. So if you're wondering if you're taking the right amount of supplements, you can go back and listen to episodes number 53 and 54. You can find links to the podcast, to the newsletter, to the Facebook group, any of these things that you're looking for on my research page. And that link is breakingdownnutrition.com/resources, breakingdownnutrition.com/resources. So besides your recommended supplement, food choices can make a difference in your hair too. You know, I'm all about food. I like to pick and choose wonderful food that will be loaded with the nutrients that you need. So when you have a diet that's rich in omega-3 fatty acids, vitamin A, iron, zinc, folic acid, vitamin C, B12, and B6, then this diet's going to support new hair growth. And I know you're thinking, I don't know what this means in terms of food. That's okay, I'll tell you. So think salmon, tuna, and walnuts for omega-3s. Sweet potatoes, spinach, and tomatoes all contain vitamin A. Plus, spinach is also a source of iron, folic acid, and vitamin C. That's a nice trifecta, right? That's what's so great about the beauty of food, is that they're not just typically a single nutrient. They're multi-nutrients that all work together in the body. Oysters, lentils, and eggs all contain zinc, and eggs are a good source of biotin. Beef contains very absorbable iron called heme, H-E-M-E, heme iron, while lentils and black beans also contain a plant-based iron. And when they're eaten with a vitamin C-rich food like red peppers or tomatoes and citrus fruits, these help with improved absorption of that plant-based iron. So these are just a few foods that you can pick for hair health. Now, number 3, here we go. Get ready, protein. Be sure you consume 60 to 90 grams of high quality animal, soy, or dairy-based protein and protein powders when needed every single day. Lack of protein causes your hair to become thin and fall out, which you don't need if the surgery has already pushed your hair into that dormant stage. I hear you. This hair loss isn't fun with all of the other changes you face in your journey, but it will end, and sooner than you think. Time has a way of passing by quickly. So here's what I want you to do this week. If you're multitasking, come back to me and listen closely. Focus on you. This is your journey. Take your proper bariatric supplements. Plan your protein daily. Check in with your healthcare team if something seems amiss, and then go back and look at the many foods I just mentioned that help with hair health and start to include them in your diet, because you are worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC, All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories, LLC.